Hello, my name is Lane Bailey. I'm a physical therapist and director of research from Memorial Hermann Ironman Sports Medicine Institute. Today we're going to be covering some post-operative knee rehab exercises. Our first exercise is the quad set. Quad set's very important after surgery to help regain quad activation. This is something that's often challenging to do due to the trauma of the surgery and the injury that preceded it. So we're going to have Morgan demonstrate the quad set. Essentially what we're trying to do is not move the knee, but try to activate the quad. You can see here whenever she has her quad activated, she can lift her heel, and whenever she relaxes, the leg goes back down straight. That just demonstrates that she has a good ability to activate her quad and straighten the knee. So you're trying to focus again on squeezing the quad, straighten the knee, or lengthen the back of the knee down towards the table without pushing down into the table. You may not have the ability to actually get what we call hyperextension of the knee, and that's when the knee actually extends beyond zero. If you don't have that ability, you will not be able to see the heel lift, but again, we're focusing on the ability for the quadriceps muscle to contract and remain on throughout the duration of the exercise. So try to hold this contraction for anywhere between 5 and 10 seconds. There's no limit to how many of these you can do. It's safe for your knee, and at the end of the day, it will allow you to get up, walking around, and off your crutches faster. Now we're going to cover the straight leg raise. This is again a very important tool and important exercise right after surgery. You can see here Morgan is lifting the leg. The first portion of this exercise though is the quad set. So make sure you have a good quad set before you try to do a straight leg raise, as the integrity of the exercise or the ability to be able to perform it will be significantly influenced. So you can see Morgan relaxes and then she contracts while she lifts the leg. What we're trying to emphasize and stress the importance of during this exercise is that as she comes down, the leg remains straight and the calf or the back of the knee touches before the heel. Again, if you don't have hyperextension in your knee, you may not be able to achieve it, but we want to make sure that we actually allow that to occur. What we see sometimes and often after surgery is called a quad lag, meaning whenever you try to lift the leg, you'll see a slight bend in the knee. So as you come down and descend towards the table or the bed, the heel will touch before the back of the knee or the calf. If this is the case, we need to continue to try and emphasize the fact that we want to maintain the knee as straight as possible throughout the course of the exercise. So again, as Morgan demonstrates a good straight leg raise, we'll see her calf touches before her heel. So if you can't achieve this straight away, continue to try to focus on it because it will make your straight leg raise much more effective in the long run. One of the first stretches we can do after surgery is a calf stretch. Being in a mobilized position for long periods of time, the muscles in the back of the knee often get tight, so doing a calf stretch occasionally and frequently throughout the day can be something that's effective for you in terms of your symptoms and how you feel, but also help maintain the health of the joint itself. So Morgan is using one of our stretch bands here. You can use a lot of different things at home, whether it be a towel, a long belt that you loop around to the sides of your foot, a toe strap, things like that. Anything that actually captures the ball of your foot and allows you to place some light pressure to where you feel a stretch in the back of your knee or your calf is what we're looking for. You want to hold the stretch for around 10 seconds and we'll do a period of 5 to 10 repetitions. As part of our initial exercise program, all the exercises are important, especially the next exercise. This is called an extension hang, and there's not much to this exercise aside from propping your leg up onto a bolster, onto a pillow, or something that elevates your leg and allows gravity to straighten your knee. This is not the most comfortable exercise to perform immediately after surgery, as your knee will feel more comfortable in a slightly bent position, but it's very important that we do this throughout the day. You want to try to get in at least 5 sessions a day where you allow the leg to be propped up on a bolster and extended as gravity tries to straighten the limb. Again, the more often that you do this, the better you're going to feel and the easier it's going to be on your quad to actually turn the muscle on. So make sure that you do this throughout the day and as many times as you feel comfortable doing this exercise, the better for you. Next, we're going to do hip abduction. Hip abduction is meant to strengthen your glutes early on within the rehab process, and it's a safe and effective exercise. So here we can see Morgan lying on her side. The affected limb will be the limb that's on top. The bottom leg is bent to 90 degrees to take pressure off the hip and off the low back. And Morgan's going to lift her leg straight up and slightly angled backwards. While you're doing this exercise, you want to make sure that you're not rotating back too far to substitute with the muscles in the front of the hip, and that you're staying closed with your pelvis. So lifting up just above parallel with the ground, come back down to the table in a nice slow controlled manner. We're going to do a series of these exercises, and if you're feeling this in the right place, it will be in your glutes, kind of in the posterior hip in this region, and not in the front of your hip. So make sure that you're trying these 2 to 3 times a day, and again, trying to feel it in the right spot on your hip. Now we're going to demonstrate a short arc quad. So this is performed with a bolster or a pillow, something underneath the knee that has the knee flexed to about 20 to 30 degrees. Here you can see Morgan demonstrating. She's allowing her leg to remain bent on the bolster and then straightening the knee completely, focusing on a nice quad set at the top of the motion. Then she'll slowly control the motion back down towards the table, tap the table, and come right back up. We'll do a series of these, and as you're feeling this in the effective place, we're going to see this burn on the inside of the knee. Now we're going to demonstrate weight shifts. Early on within your rehab protocol, if it's within the boundaries of your protocol and your surgeon's recommendations, we can start to put weight on the affected limb or your surgical limb. So we're going to allow Morgan's affected knee to be the right limb in this scenario. She's going to start out with all of her weight on her left side. Prior to shifting weight onto the right side, she's going to squeeze her quad and straighten the knee as tight as she can. And then once that's achieved, she'll slowly rock over, putting weight on her right or affected side, holding that for about 3 to 5 seconds, maintaining that good tight quad activation, and then shifting her weight back to her left leg and allowing the limb to relax. When you're doing these, we can do a series of 8 to 10, again focusing on getting the knee as straight as possible and squeezing the quad as tightly as possible while you're putting weight on it. You want to be careful not to allow that limb to relax whenever you're actually shifting onto it, because then that can put you at a risk for fall. So make sure that you're actually getting a nice tight quad contraction before rocking over. Next, we're going to do heel and toe raises. This is to help you maintain and regain your balance after surgery, as oftentimes we'll see deficits. Morgan's demonstrating this exercise. You want to make sure you're next to a counter or something that will provide good stability so you're not going to lose your balance and potentially hurt yourself. She's coming up onto her toes, and then she'll come back down and rock onto her heels. And then do just the opposite. So it's a motion that we're rocking back and forth with, again trying to put equal weight through both limbs, and then back down. And you can see how this works both sides of the lower leg, both the calf and then the muscles in the front of the shin.